We have our last speaker for this session, which is Roisin Sweeney from Western Australia, from Perth. So she flew a long way to get here. And Roisin manages the community-focused injury prevention programs designed to contribute to a population-level reduction in injury rates in Western Australia. She has a Bachelor in Preventative Health, a Master's of Business Administration, and over 10 years of injury prevention experience. Roisin's key interests include supporting the adoption of evidence-based practice within the community setting and improving injury outcomes within priority population groups. Please welcome Roisin.
Thanks, Kim, and thanks to the network for having me here today. It's great to see the diverse range of people that are in the room, and I'm very envious that we can't hold something like this every year in WA. That would be amazing. As Kim said, I'm going to talk today about the Stay on Your Feet program that we run over in Western Australia. I do acknowledge that you're all from different disciplines and can potentially take different things out of what we do today, so hopefully there's some component of the next 20 minutes that you'll be able to apply to your work. Before I get started, though, I would like to thank Uncle Alan for his beautiful welcome to country this morning, and also the privilege that it is for us to gather today on the Gadigal Nation, and also pay my respects to the elders past, present and emerging from over in Western Australia, which are the Whadjuk Noongar people, and give thanks for the privilege that it is for us to deliver our program on their beautiful country. So if anyone's not aware of Injury Matters, which I'm going to guess is a fair proportion of the room here, we're basically a not-for-profit organisation over in WA who conducts a whole range of different activities focusing on community awareness raising, capacity building for the health sector and also advocacy. And one of the key programs that we deliver, and our longest standing program, is the Stay on Your Feet program. I will recognise that there are different forms of the Stay on Your Feet program happening across the country. So today I'm purely talking about the package that we deliver over in WA and the different projects that sit within that. And for us, it is an awareness raising program and also an education program that's really working with community members, health professionals, advocates, and everyone in between, family members, volunteers, that has a role to play in supporting older adults who live independently in the community to reduce their risk of having a fall. We are funded by the WA Department of Health and have been doing so for 25 years this year. So ultimately, the program is working towards the department's goal of reducing the incidence of falls and falls-related hospitalisations in WA, but for us, our focus is on awareness raising and education, as I said. So we want to raise awareness around the falls are preventable, firstly, the risk factors for falls and the importance of healthy ageing, and also building that knowledge and understanding around what people can do to reduce their risk of having a fall. As you'll see over the next 15 minutes, we do have a majority of our activities targeting the older people themselves specifically, which is our primary target audience. So that is older adults who live independently in the community, 45 years and older for our Aboriginal people and 60 years and older for non-Aboriginal people. And then our secondary target audience, as I said, is everyone else. So whether that's health professionals, volunteers, the diverse range of allied health professionals in particular that are working to support these older adults. Now, we are really fortunate to have delivered the program for 25 years, and thankfully the program has evolved over that time. It did start out purely as a peer education program, but we have evolved since then to deliver a whole range of different initiatives. We've done everything from media stunts, big events, community capacity building activities, but realistically the things have evolved following co-design with the community over the years, and also to try and fill some gaps within our falls prevention landscape on a statewide level. The faces of our program has also evolved. We started out with real people, we moved to cartoons, we moved to animations, and lastly we moved back to real people. So it just goes to show the importance of that continuous co-design to make sure we are meeting the needs of the community, which is really who we're trying to help at the end of the day. But yeah, no matter what it looks like or what it is now, the older people themselves and reducing their risk factors of falls has remained central to the program. So some of you might be familiar with this. This is our key slogan that's central to everything that we deliver. It's move, improve, remove. So it's talking about encouraging older adults to move your body, improve your health and remove hazards in order to prevent falls. You'll see there's some key calls to action that sit within each of them. I guess it's still a lot to digest, but we've heard that already today. There's so many different risk factors that contributing to people's risk of having a fall, so we do need to address those key pillars. But it is a lot still to digest 8 different calls to action with the community, so we break it down into 2 different campaigns a year. So they run for 3 months each, and all of our activities focus on just that one slogan. So currently, from March till May, we're in our Improve Your Health campaign. So everything from our training activities to our media stunts to our community presentations, all central on those 3 calls to action that sit within that messaging to hopefully not dilute the message too much over time. So what exactly do we do with this messaging? There's kind of 2 key pillars to our program. The first is awareness raising, so that's all of our community-facing activities, our primary target audience that I mentioned, and then the second pillar is workforce engagement, so that's all of our sector-facing activities. And there's a few different projects that sit within each of these, so I'll touch on each of them very briefly, but hopefully you'll gain something from each of them independently. So 10 years ago, we launched our first mass media campaign, which is a big deal. I know some states are still crying out for that, but after 10 years, thankfully last year, we were able to build a new campaign because I guess us as a team, we got tired of hearing the slogan and the jingle playing, so I'm sure the community felt the same. So we were able to do consultation with hundreds of local older adults and also partnered with a media agency to develop some new assets that better reflect the message that we were trying to convey in 2026 now, and also to be more representative of the community, because we know that from the consultation and focus group testing that we did with our previous collateral and obviously testing some new collateral along the way as well, older adults wanted information that was relatable, had a focus on the simple tips they could do to prevent falls, that it was motivating and also had an emotional impact. So trying to convey this in 15 seconds can be challenging, but yeah, we're really proud and excited by what we were able to launch in September last year. So these are the key 3 images, and there's different assets obviously that sit within each of those campaign themes, but ultimately the underlying message remains the same, but the call to action slightly differs across each campaign. In terms of the distribution of these, we work with our media agency to adapt them to different TV stations, shows, print media publications, social media platforms that have the greatest reach with the target audience that we're really trying to influence. And fortunately, this campaign, we're also able to show them on Aboriginal medical services across the state as well, so getting some more tailored reach within our Aboriginal population as well. I am going to play for you the Move Your Body advertisement. It goes for 15 seconds, which is very, very quick. So just get ready because it will start straight away.
From the age of 60, your risk of a life-changing fall increases. But moving your body a little every day goes a long way in preventing a fall. Stay on your feet.
So as I said, a lot of time, energy and money goes into that 15-second development, and it costs even more to roll it out on TV. But yeah, we're really proud. We think it's more representative of the community that we're trying to influence at this point in time as opposed to our previous messaging. And hopefully you caught the fact that there's the generation of assumption that someone has fallen, whereas in fact there's somebody in the gym working out to build their leg strength. So each of the campaigns follow that same messaging, because our focus group participants were really adamant that they wanted something that doesn't dismiss or ignore the consequences that do come from falling, but like I think it was 96% of participants did not want any scare tactics being used as part of the campaign. So making sure that positive framing is still really central to everything that we're doing. We're about to roll out the first evaluation of our campaign next week, which with my evaluation hat on, I'm very excited to see how it compares to previous evaluation we've conducted with our old media assets. But yeah, quantitative feedback that we've gone from when we're out and about in the community has really shown that yeah, people are seeing it and hearing it and hopefully doing something about it once they've heard it a few times. So that's one of our awareness-raising activities or projects that we roll out. Another key pillar to the program are our resources and our website. So as an information and awareness-raising service and program, obviously that reach and distribution of education and information is really key. On our website, we have a whole range of different resources, fact sheets, an online e-directory for people to find local falls activities happening in their area, home safety rooms, videos, interactive quizzes, you name it, we've tried it. And also the information is broken down for health professionals and community members to hopefully be able to provide and, I guess, pitch that information at an appropriate level to each audience. We are really proud of our suite of resources, and they're probably one of the most popular things that we do as part of the program. Unfortunately, we're not able to distribute them across the border, but for people based in WA, they're able to order them online free of charge, and we can distribute them out, whether that's individually to people in their own home or to local health services or community groups as well. But please jump online and have a look if you haven't already seen our suite of resources. You're definitely more than welcome to download them and share them within your clients or patients and colleagues. But yeah, as I said, unfortunately, the print resources have to stay across the border. Even if you have seen the resources before, we've recently been working our way through updating the suite of resources. So there might be a few new ones you haven't noticed before. So don't get me wrong, our mass media, our resources and our website are great projects, and they enable us to get the reach that we need across the state. But in terms of the human impact and a personable approach to our program, that's kind of where our peer education project comes into it. So thanks to a passionate group of volunteers, some of which you can see on the screen here, we're able to provide free 1-hour community-based presentations out in the community, upon request, of course, from the community themselves. We currently have 14 volunteers, 10 of which are or were previously allied health professionals, which is a great skill set, obviously, for us to have within the team. So whether they're ex-physios, ex-nurses, we have a nutritionist as well as part of the team, and a pharmacist, it's great for them to be able to share their expertise out in the community as well. So yeah, we can deliver presentations to a group of 10 or a group of 100, depending on what that demand is. They're generally local libraries, community groups, probus clubs, men's sheds, where the older people are generally gathering on a weekly basis. We're really privileged to be able to enter that environment and, fly the falls prevention flag for that 1-hour session. We are a statewide service, so unfortunately our peer education model is currently just metropolitan based, so we do rely on our annual visits every year to the regions to meet some of that community-based demand, and we have recently trialled a little bit of a pilot with some Wheatbelt WA Health staff to figure out if we can adapt that peer-based modelling to utilise some of those allied health professionals within the regional areas. So we're really keen to see what that looks like in a couple of months' time once we finish the pilot, because we've already got interest from other regions across the state to roll that out, which will be great. I guess we would not be able to do what we do without our peer educators, so definitely they're invaluable to us in terms of implementing the program and getting the reach that we do. And final element of our community awareness raising activities is community outreach. So during every campaign, you can see on this little reel here, we'll host community events, generally in partnership with a local service or a local government, and bring together 50 to 100 local adults to provide some presentations and some interactive sessions on whatever campaign topic is in focus. It's really just about bringing the group together and giving a go at different activities, whether that's exercise-based activities that were in this video, or cooking demonstrations or cognitive classes, whatever it is, and also having the local services there as part of the day so people can get that referral or engagement from other people they can reach out to after the session has ended. Like any other good health promotion initiative, of course, you'll catch the team or our volunteers out and about at different stalls across the state as well. So once again, just providing a different avenue for us to distribute our information, and also potentially to reach some people in the community that might not engage with other elements of our service. So not always attending those stereotypical ageing events, thinking a bit more innovatively about how we can capture some people out and about at general community expos, caravan and camping shows, Wheatbelt health events, things like that, wherever people might be congregating. So that's kind of community, that's awareness raising, and then the other arm of our program is workforce development. So we offer a range of in-person and online falls prevention sessions, such as like the range that you guys deliver here in New South Wales. But given the diversity of health professionals that we are trying to influence and build the capacity of, it does result in us needing to roll out a range of different, I guess, more tailored presentations throughout the year. To give you some context, I guess, last week we rolled out a webinar on incontinence and falls prevention. Yesterday the team did a session with a local OT group around falls prevention and occupational therapy, and next week we're doing a strength and balance session with a local physio clinic. So always trying to think about what tailored support do those different health professionals need to understand their role in falls prevention. We also have online learning modules, of course, to provide that free self-paced learning for people, which cover a whole range of different topics. And finally, we facilitate a community falls network, which is just a quarterly forum for people to get together to discuss what they're finding are the wins and I guess also the challenges in their role, so we can come up with some shared solutions about what we can do and provide that cohesive approach to falls prevention. Support is all well and good in building the capacity, but sometimes it does come down to money and resourcing. So our grants project helps out with that a little bit. So to support people in implementing community-based falls prevention activities, organisations and community groups and local governments are able to apply for grants twice a year for up to $5,000 to roll out a community-based initiative that is meeting local needs and also aligns to our current campaign message that will be happening during that point in time. For example, currently this campaign, we have a multicultural organisation rolling out a 12-week program for different cultural groups in their local area around the three calls to action within our current campaign. We have a regional local government as well rolling out an 8-week nutrition program. We have a allied health service delivering, which we're really excited to see what the evaluation looks like for that one, a program specifically for isolated older adults, but it's an intergenerational program as well, so a little bit of a different approach to the Improve Your Health messaging there. But yeah, really they're ultimately, I don't want to put a percentage to it, 80% of the grants are awarded to regional communities and groups because we unfortunately don't have the level of, I guess, the system that you guys have in your New South Wales health districts over in WA, so there is a reliance on getting additional resourcing out to the regions to do some more grassroots activities regarding falls prevention. We are really passionate about coaching our recipients as well throughout the grant to make sure it's as evidence-based as it can be, and we don't want that, grants can sometimes be scary to write and submit and to roll out, so to give the opportunity for smaller groups to pilot some initiatives, hopefully get some successful results, and then seek out some long-term funding as a result. $5,000 is not a lot. It used to be $500, so we're happy to put an extra zero on the end now. But it's ultimately just some seed money to hopefully kickstart some form of initiative and realise it doesn't sometimes take a lot of resourcing if you've got great local stakeholders that you can collaborate with on those initiatives. I've put a bit of a case study up on the slide here. I could have chosen one of 100. This was a program that was rolled out end of last year, an 8-week Otago exercise program, 3 hours south of Perth in the Margaret River region. For anyone who likes a good wine, you might have visited that over in WA. And just to showcase that with $5,000, they were able to roll out the program thanks to partnerships with the local government and local rec centre. They got 40 older adults participating in the program. Amazing results, pre and post falls risk assessments indicated there was improved balance scores, sit to stand times, knowledge of falls risk factors and social connection as well amongst the group, which we've heard is really important already this morning. And then due to the demand of the sessions and the successful results, the local government has now supported the initiative ongoing, and also rolled out different pilot sites as well throughout the region to be more accessible to the older adults living in the southwest of WA. And then finally is our influencing activities. So I think it's fair to assume that amongst the room here today, we all know that falls is a public health priority, but unfortunately that's not the case with the decision makers and policy makers that could help us in our joint mission to prevent falls and falls-related harm amongst the community. So central to our influencing work is our annual falls report, which provides that database for us to demonstrate the growing burden that falls is having across the country. But we recognise that numbers aren't the be-all and end-all, and this quantitative numbers is a great part of the story, but we make sure that we always build in those lived experience stories as well. So we want to collate those personal stories to showcase what impact falls do really have on people's lives, and also to showcase some case studies around what could be done to reduce the impact that falls is having. And as you'll see there, it's either, ourselves will never turn down a media opportunity, of course, to raise awareness, or our lived experience advocates as well, who we're more confident for them to get behind the camera and share their story, rather than myself or the younger members of our team, speaking on behalf of our target audience. So despite all these achievements, it would be remiss of me not to acknowledge some barriers that we face in implementing the program. Of course, there's challenges that we all face, those first couple on the slide there, in all of our falls prevention efforts, whether that's the ageing population, funding constraints, challenges within health service integration, or competing priorities amongst health portfolios, or different needs within the government system. We do face these as well, we all do, of course, but I guess for us on a project or program-specific level, distance is a huge barrier for us. As I mentioned, we are only based in metropolitan Perth. WA is a fairly large state, I think it's fair to say, so our engagement with our regional older adults and health professionals is reliant on hybrid forms of engagement, of course, and our mass media activities and our annual visits to the regions, but that's not the same as us, of course, having satellite offices across the state. But we're grateful for what we have and the strong relationships that we've been able to build within the regions, but it's still a barrier in terms of us getting that authentic engagement with the community. As an awareness raising program, a key part of our role is to link older adults in with local services to get the support that they need, and having the lack of accessible but also evidence-based falls prevention activities happening in the community does prove a barrier for us. It's all well and good us saying you should be doing all these things, but how do they actually do it in practice is obviously a challenge for everybody as well. And finally, capacity is always a juggling act. We are a small team, we have 5 FTEs, so it is often comes down to choosing one thing over the other and using our resourcing the best way that we can to hopefully get the greatest impact for the program. So I'm hoping by now you're thinking this all sounds well and good, your media looks very flash and your resources look great, but what does that actually mean in practice? We are an awareness raising education program, as I keep repeating. We are not an individualised service like the amazing work we've already heard this morning. So spreading our message and getting the reach is really central to us achieving our objectives. So I've got some stats on the slide here, but annually we reach about half of WA's older adult population purely through our mass media activities. We distribute over 130,000 resources. We have over 60,000 people visit our website. Thanks to our amazing volunteers, we're able to deliver about 130 peer education presentations every year to reach 2,500 older adults. And we deliver a range of training events, as I mentioned, to reach about over 1,000 different allied health professionals within that portfolio. So we like to think we're quite resourceful for a team of 5, but we know we could do a whole lot of more with more resourcing, of course. I could do a whole nother presentation on evaluation and the actual impact and research results of our program, but overall we continuously meet our objectives, and comparisons with control group analysis support that those who engage with our program are more likely to agree that falls are preventable, understand the risk factors for fall, and implement strategies in their day-to-day life to reduce their risk of having a fall. The reach and quantitative results are also great, but as we've already heard this morning, it's really the people and those stories that come out of it. So we want to make sure that ultimately we're not losing sight of that older adult that we're trying to help at the end of the day, and the impact that that has on them is more important to us than any other stat that we tick over in terms of those engagement slides I showed you before. I had a look through, there's some quotes here of course, but I just jumped into our inquiries, inbox on Wednesday to have a look at what's already happened this week. So just as like a little snapshot of just like 1 week, a couple of days, what's actually the impact of the program. An older adult reached out that was isolated, but now is connecting with a local group once a week and has built friends and a community within that group setting. We had a daughter email to say that how helpful she found the resources in getting her dad the help that he needed to stay safe and, safe for himself, but also for herself in his own home living independently. And also an email from a grant recipient saying the noticeable improvements they've already experienced within their participants' mobility as a result of rolling out the grant only for a couple of weeks so far. So we're grateful to have the program and obviously more grateful to be impacting the lives that we're able to do because of that continuous funding that we are fortunate to have in WA. Just quickly, before I wrap up, I guess I would love to be able to not necessarily copy and paste because we want it to be tailored to each setting, to be able to roll out a similar program across WA for all older adults to have access to this, but acknowledge that due to funding constraints and structures, we're not quite there yet. But we're always happy to join any joint advocacy activities to showcase the importance of awareness raising and education programs as part of our suite of falls prevention activities. But until this happens, because it will happen, it's just until when it happens, there's some fundamental principles of our program that I feel like people would be able to apply to your roles, no matter what your role is in falls prevention at the moment. The first one up there is our focus on healthy ageing. So since we made that switch in 2015 to the Move, Improve, Remove slogan, no matter what evaluation we roll out or what co-design activities we deliver, it always comes down to that positive framing and making sure that that is the focus point of all of our activities. The second one there is around acknowledging that we can't be everything for everybody, and we do have to have different engagement strategies to reach the quantity of people that we are trying to reach. So we do have a 9 to 5 inquiries line that people are welcome to contact to get that personalised support, but realistically without our website and our mass media and resources, we wouldn't be able to achieve what we do achieve, or at least as efficiently as we do. In terms of our awareness raising activities, we've tried to make the new material as inclusive as possible, but we recognise that we're trying to reach multiple generations within our target audience, so it's, unrealistic or ignorant for us to roll out the same campaign for all older adults aged 65 years and older, because we know that some older adults are still working or very mobile and have great support to live independently in the community, whereas might have more frail 90-year-olds who do need more of that targeted intervention. So we do make sure that we are proactive in creating different assets to reach different personas, I guess, within the community. As I said, we are a small team, so we are reliant on our amazing volunteers and also our partnerships with different stakeholders and organisations across the state. So I would encourage everyone to be as proactive as possible to reaching out to like-minded people like all of us in the room today to see how we can bring our resources together to have the most impact in the work that we are doing. And finally, of course, is co-design and keeping the older adult at the centre of all decisions that we do make. We are a multi-skilled team at Injury Matters, and we have been rolling out the program for 25 years now, but we're still learning every day from our target audience what they want and how they want that information conveyed to them. So hopefully that's given you a bit of an insight into what we do over in the West in terms of the delivery of the Stay on Your Feet program. Please don't hesitate to get in contact on the details there, of course, over lunch or later this afternoon. Always happy to share more information about what we're doing. And thanks again to the network for having me, and happy to take any questions if we have time, maybe not.
Thanks, Roisin. That was very inspirational talk and inspirational work that you're doing at WA with Injury Matters, and I hope we all feel inspired by this. And we are also with the Alliance for Falls Prevention that we have set up, which is going Australia-wide, working together with WA Matters to hopefully do something a bit more national. Like that, it's still aspirational, that one, but hopefully we can make that happen. But please join me in thanking Roisin for a wonderful talk.